This short video is going to talk about the changes in QOF requirements for cancer care reviews and how you might best meet your targets. As previously, CAN 0001 is for the practice holding a cancer register within your practice. Practices need to ensure correct coding of new cancer diagnoses for patients. The changes in QOF focus on key times of need when patients may feel vulnerable. These are at the time of patient's diagnosis, within 3 months, and after a patient has received acute treatment, within 12 months. In order to support patients after a cancer diagnosis, we would recommend practices offer support in various ways. Primary care teams often choose to reach out with a telephone call once they have learned of a patient diagnosis. This gives patients an opportunity to discuss their concerns and also gives primary care the chance to signpost patients to local support, perhaps using social prescribers and how we might support them in primary care. Practices may also choose to send a letter after a new cancer diagnosis, letting them know what support is available and perhaps having a named GP for that patient and offering a telephone review. Practices may also choose to send an AccuRx text called Macmillan Support Services, seen on the bottom right here. For the early offer of support review, the alert on EMIS will be shown on the left-hand image with the correct SNOMED code shown on the right. For practices in North Warwickshire with the PCIT system, the one monitoring box will appear as a QOF reminder, as in the lower image. The details of how to ensure the correct coding will be shown in the other video. The second change is, rather than a cancer care review within 6 months of diagnosis, the requirements now are for a holistic cancer care review using a structured template within 12 months of a diagnosis. You can find out your QOF status in the cancer denominator section and perhaps utilise your population excluded list to recall patients for their holistic cancer care review. It will be helpful for your practice to think about how you prepare the patient to understand the purpose of a cancer care review and invite patients for their cancer care review after they've finished their primary cancer treatment. There are some ideas here to get you started, but key to the process is knowing what would work best for your patient population. In order that the consultation can be guided by the patient's concerns, it can be helpful to send a patient questionnaire when you've invited the patient for their cancer care review, whether by a written questionnaire or AccuRx Florey.